Hello, in this video, I'm going to be talking about a special caution about alternative therapies. Before I go on, I'd love to invite you to subscribe to our channel because we put content out about all sorts of things, often things you've asked us to address. We're also updating many of our older videos, so do subscribe. Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at yerbba.com to take control of your breast cancer journey. So I want to talk briefly about complementary and alternative medicine, which is called CAM, C-A-M. Complementary therapies are ones used alongside what one might call allopathic medicine, what you get when you go to most hospitals or doctors' offices. These are complementary therapies used in addition to. Alternative therapies, many of those can also be done with more standard treatment, but some people choose not to pursue what one might call conventional therapy. And we have a study of 281 people who chose to receive alternative therapy instead of conventional therapy. They were identified through a tumor registry, the National Cancer Database, which works with hospitals, where every single person who has a cancer diagnosis gets entered into a registry so we can track quality and outcomes based on the treatments that people get. This registry had 281 people, not very many people in the entire registry of thousands of people who did not get standard or conventional anti-cancer therapy. And their life expectancy was significantly lower, on the order of years, lower than people who proceeded to more conventional, standard recommended treatment. They also had a much higher mortality rate at 5 years. So again, these people were not being seen in a doctor's office. Nobody really had a chance to talk with them about options that were available or that became available since their diagnosis. They weren't really in a therapeutic alliance with a medical team. They basically went off on their own. Some may have had consults, but most of them did not. They basically declined or rejected conventional therapy. Specifically in the people with breast cancer, those who chose alternative therapies over standard therapies had a 5.7-fold increase in the risk of dying at 5 years. So the bottom line is that conventional therapy alone, while I understand, we can all understand why people would say no thank you to the types of treatment we talk about on our channel, the types of treatments you learn about when you go to yerbba.com. And we also want to be crystal clear that there are downsides to this. I am not saying this just because I'm an allopathic doctor. I do believe in what I do. I think sometimes we overstate the benefits of what we do, but we do believe in what we do. We honor people's individual choices, and I have seen patients who say, I'm going to try such and such for now, and if that doesn't work, go and see the doctor at the hospital I was referred to. But for those people who reject all sorts of conventional medicine, they really are likely to die sooner. And I would say they often die in pain because they're not in the hands of medical providers who can help manage their pain. I'm not trying to bring you down. I just want to let you know what we have from this one study. We'll put the citation up here if you want to go look at it yourself and take a look at it. Drop a comment or a question below. It's really important that we still respect people's autonomy and the choices that they make while giving them the highest information support and values-aligned care. Thank you for watching. Drop a comment. We'll see you next time.